Sleep Deprivation and Learning by Melissa Freed in preparation for Concordia University, Wisconsin's Educating the Adult Learner class. Hi, and thanks for joining this presentation today. Today we're going to talk about the general information about sleep, impact on sleep deprivation, including public safety, overall health, and the brain, impact of sleep deprivation on learning, neuroscience-based approaches to help adult learners with sleep deprivation, and recommendations to help those who are applying this theory to other adult learners. Did you know that 1 in 5 adults fail to get enough sleep each night? And it's suggested that adults aged 18 and older get at least 7 to 8 hours of sleep per night. And your body does amazing things while it's sleeping. Some of these things include repairing your heart and blood vessels, and it even removes toxins from your brain that were built up while you're awake. So now we know the importance of getting enough sleep, but what happens when we don't get enough sleep? Well, let's first take a look at public safety and sleep deprivation. When we don't get enough sleep, our brain can't function properly, so it's a safety hazard. Sleep deprivation is the cause of over 6,000 fatal car crashes per year. Moreover, it's estimated that 1 in 25 adults fall asleep at the wheel each month due to sleep deprivation. Now let's talk about overall health. Sleep deprivation is a health concern because it causes higher hunger hormone levels, lower levels of appetite control, and it puts you at a 50% higher risk of obesity, which is 3 times the normal risk. Furthermore, sleep deprivation causes your body to create less active immunity protectors called natural killer cells. With a decrease in these cells, you're 3 times more likely to catch a cold. If that's not bad enough, you increase your risk for colorectal cancer by 36%. It increases your chance of having high blood pressure, and there's a 48% increase in developing heart disease. But that's not all. When we don't get enough sleep, it affects our brain. Studies at Johns Hopkins Medicine found that when you have sleep deprivation, you're 33% more likely to have dementia. You're at a greater risk of depression, irritability, anxiety, forgetfulness, and fuzzy thinking, and your brain can age up to 3 to 5 years. 73% of students don't get enough sleep, and there's a connection between REM sleep and the integration of new information. Moreover, sleep-deprived students often suffer from mind wandering, which can then make it difficult for them because they've lost track of the task at hand and ultimately have a harder time achieving goals. This makes complete sense because mind wandering can reduce the effectiveness of learning. Another area of learning that can be impacted is motivation. In some cases, motivation can make up for lack of cognitive performance, but when a person is sleep deprived, they can lack motivation. So how can instructors help their students? Universities and instructors can provide students with training about appropriate sleep habits and patterns and explain how they relate to performance. Moreover, talking to students about scheduling classes around times where they struggle with the most tiredness. For example, if a person struggles with tiredness in the morning, perhaps it would be best if they scheduled their classes for afternoon or evenings. My recommendation for others who plan to apply this theory to adult learner courses is to be in tune with your students. If you notice that they're mind wandering, chat with them about the importance of sleep and other approaches they can take when planning classes. Make it relevant. Make the information that you're teaching about relevant to their lives so they have an easier time remembering it. And place the student in a stimulus-rich environment. If a student is not sitting down the whole time, there's a better chance that they will stay on task instead of mind wandering. Now let's do a wrap-up of what we talked about today. We learned about general information about sleep, impact of sleep deprivation, impact on sleep deprivation and learning, neuroscience-based approaches to help adult learners with sleep deprivation, and recommendations to help those who are applying this theory to other adult learners. Thank you again for joining my presentation. Have a great day.